private practice in Safford, Arizona since 1987. Dr. Curtis is past president of the American Association of Dental Editors and Journalists, the American Academy of the History of Dentistry, the Arizona Dental Association, and the Arizona Dental Foundation. He's a longtime editor of the Arizona Dental Association, past associate editor of the Academy of General Dentistry, author of 4 books, 600 articles, and he also teaches writing at Arizona State University. And now we turn the webinar over to Dr. Curtis.
All right, I think I'm up. Molly, can you hear me?
I can hear you perfectly. Thank you, Dr.
All right, very good. Well, let's roll into this. Thank you so much for such a nice introduction. And I thank everyone for being here this morning, and thank you so much for your interest in dental communications. You know, I want to take a second and applaud the efforts of the American Association of Dental Editors and Journalists for reaching out to its members like this. Thank you particularly to the people I've been working with the last several months, to the AADEJ current president, Dr. Brian Hsu, a shout out to you, to our continuing education director, Dr. Richard Rocap, thank you for your help, and to our executive editor, Dr. David Chambers. Thank all of you for bringing this session to fruition. And you know, computer-driven education, which we are deep into these last 12 months or so, has been thoroughly challenging for me. This semester I'm teaching an undergraduate college class in writing, in which I both have online and in-person participants at the exact same time. It's hard, but I'm encouraged by the thought that the teacher's job is not so much to just deliver knowledge, but maybe even more to inspire learning. And the late, great Chicago Sun-Times columnist Sidney J. Harris once wrote that the whole purpose of education is to turn mirrors into windows. So I'm going to give that a shot. In the next half hour, I'm going to describe my process of writing, the things I think about, the techniques I like to engage with, the ideals and the principles that I struggle to achieve. And admittedly, some of it may sound a little pedantic, a little bit like theoretical schoolroom stuff. But for me, all of it's practical. And of course, I guess I'd have to say that to start out, my best advice for writing is to read, and to read a lot, and to read widely, and to read constantly. And it's also my best advice for living, incidentally. Reading well-edited prose, it opens your mind and it trains your eye, particularly if you're going to be a writer. My next best advice for an aspiring journalist, an aspiring editorial writer particularly, is to write. It has to become a habit, and it even has to be something of a compulsion, I think. You sit yourself down and you squeak out some product every single day, all the time, at least several days a week anyway, even if it's just a paragraph of observation or to jot down the dream you had last night. All of it is grist for the mill. All of it helps you train your eye and your hand to getting what you need to be done. The writing most traditionally associated with dental editors, of course, is the editorial. And editorials are think pieces. They're analyses that illuminate the issues that confront the profession. And incidentally, I would argue that we are still a profession, and we should be careful about referring to ourselves as an industry, because they're not synonyms. They're not the same thing. Maybe I feel an editorial coming on right now. The industry is the manufacturers and the supply people and the financial folks and the managers and the bean counters and the business people and the helpers and the hangers on. The industry is all about turning a profit. It's all about the money. The profession, on the other hand, focuses on the provision of oral health care. It's all about healing. Both of them have their place, but they're not synonyms. And even synonyms have their own specific connotations. There are gravitational pulls, if you will, that are based both on word origin and centuries of use. And this long use sometimes can pull very similar sounding words in different directions. And so here's an easy example. What do you think of when I say the word Hollywood? Now, if your mind conjures up the visions of a place, of a city in Southern California, near Los Angeles, maybe you envision a few palm trees, and of course the famous sign that shows up in all the movies, well, then you've responded to the word's denotation. That is its dictionary definition. Hollywood is the name of a city. But if you think instead of glamour and glitz and movie stars getting out of limousines and A-list parties and maybe facelifts and false teeth, and even of that AO porcelain shade, those of you who are in practice, that sort of toilet bowl shade. I just delivered a bridge yesterday to a woman who wanted an AO Hollywood smile. Well, those kinds of references to Hollywood, those are connotations. Those go beyond the dictionary definition of the city to explore implications and undertones that go far beyond just that sign on the side of the hill. And here's maybe a less obvious example. What do you envision, or what would you think might be the difference among these three words? Disease, illness, and sickness. Well, the denotations, the dictionary definitions of those words might place them in a similar location of health imbalance, of something going wrong with the human body. But as supposed definitions, those three words actually reveal competing points of view. Disease reflects the doctor's perspective. It's a malfunction. Disease is something that an organ has. Illness, on the other hand, reflects the patient's perspective. It's something personal that an individual has, while sickness involves a social perspective. It's a relationship. In fact, it's how the individual describes or identifies that disease plus illness state, if you will, to other people. So maybe one point is here that we should become sensitive to words, and we should select them wisely. And I'll talk a bit about this again in a second, because it's really important to me. And words, of course, are the building blocks of editorials, and editorials can be many different things and in many arrangements in any number of formats. And I've experimented with a lot of them over the years. I've done 600 word opinion pieces. I've done 1,000-word essays. And even for a year, I experimented with doing 100-word essays in a little box that I branded and put in the exact same place every year, or every month for a year in our journal. My managing editor has experimented with podcasts and with video editorials. And for me these days, partly because I'm such a devoted New Yorker fan, I'm trying the long form style, and it's a risk, right? I do 2,000 words every month in my journal, which I illustrate myself with pen and ink and watercolor. And putting out 2,000 words, admittedly, is a risk. It flies directly in the face of that received knowledge, that wisdom that says people will click away from you in 10 seconds. And maybe a lot do. I'm taking that risk, but enough others engage with me on things that I write that I feel a little bit emboldened that maybe that's something that some people are okay chewing on, and some people even like. And I've also decided the editorials don't have to be always about clinical or scientific or public policy issues, although those certainly make appropriate subjects still. But I also write editorials on baking and art and birds. In fact, there are these little goldfinches outside my operatory windows that fascinate me, and I've written about them. And I guess after 30 years of writing editorials, I want to write the things I want to read. So editorials, I think, can appear as much more loose and creative creatures than we generally imagine them to be. But regardless of their subject or their form, editorials still have to be tight and smooth and well-crafted in a way that lets them get out of our computer and somehow into the minds of our readers. And my favorite, Sidney Harris, also said that good writing is not about putting out. It's not about what we write and hit send with. It's about getting through. For editorials to be effective, they not only have to be noticed and absorbed, they also have to be remembered with enough impact to change people's thinking. And in fact, the best editorials will not only change people's minds, they'll change their behavior. There are lots of ways to write, and editorials should properly embrace a range of methods. Expository writing explains. Descriptive writing paints word pictures. Reflective writing analyzes events and circumstances. Narrative writing tells a story. Argumentative writing seeks to convince. And creative writing explores emotions and the mysteries of the human heart. None of those is off bounds or out of bounds to us as editorialists. We should use them all. And whatever the style and purpose, to be effective, all writing needs to honor three requirements. One is precision, and the next is clarity, and the third is concision or conciseness or brevity, if you will. And so let me define those. Precision, in my definition, means that we have to write what we mean to write. We have to say what we mean to say. And it sounds maybe self-evident, but it's very important because mostly we don't know what we mean. Mostly we don't think. And I don't mean this in any disparaging way, because the human condition is that mostly we just feel. I'm hungry, I'm happy, I'm sad, I'm calm, I'm excited, I'm frustrated, I'm scared, I'm lonely, I'm hopeful, I'm confident. These are all feelings. Feelings take up most of our consciousness. And we rarely analyze our feelings, much less expend energy to analyze abstract issues about dental practice, because it's a lot of work to think. So as a result of that, maybe that inescapable reality that we just stay in the mode of conserving energy, mostly we don't know what we think. And this is why writing is so very important to me. I write to find out what it is that I think. I don't know what I think until I get my thoughts down. And the act of getting my thoughts down, of carefully analyzing my thoughts and accurately describing them, often changes them. Sometimes my editorials don't end up being anything near what I began to or set out to write. And sometimes my opinions actually change as I closely observe them. Because my thinking has to evolve, my writing has to be rewriting. Now, the novelist Anne Lamott once said that everyone who aims to write anything needs to get at least three drafts, three different versions of their story. The first is the down draft, you get it down. The second is the up draft, you clean it up. And the third, she says, is the dental draft. You go through every tooth, buccal, lingual, distal, mesial, you go below the gum line, you check everything out with your explorer to make sure there are no cavities. I might go through as many as 10 drafts to finally figure out what it is that I mean to say. So writing has to end up being precise. We have to eventually write what we really mean. And we should recognize also that there are barriers to precision. Maybe we're in a hurry. Maybe we've got a deadline looming and we don't think our argument through, or we don't have time. Maybe we are embarrassed to say what we really think. We might be conflicted or torn by uncertainty, or even have hidden agendas. And here's a recent example with me. A couple of months ago, my executive director asked me to write an editorial urging our association members to attend an online meeting. The truth is, I'm tired of online meetings. No offense to all of us here this morning, 2 hours is good for me, but 3 days is hard. And I didn't really want to admit that in public, and I certainly didn't want to contradict what he wanted to get across, but it left me in a bind with regards to what I could, in all honesty, write about. So the first writing requirement is precision. And the second requirement is clarity. Writing clearly to me means that we have to write in a way that is most likely to be understood by our intended audience. So we have to know our audience. We have to connect with our readers. We have to imagine them as we write for them. And at the same time, we have to be able to go away. We have to be able to mix, and we have to be comfortable being alone. And it's said that serious writers, anyway, are gregarious loners. So we're interested in the world around us. We check out the events and the situations and the social and scientific complexities. We track down what people are saying and doing. And we also have to be comfortable spending hours alone inside our brains, organizing, deciding, understanding, recognizing what we perceive and know and think about all those interactions we've been engaging in, and looking for ways to make our thoughts about them plain and direct and receivable to the people we're writing for. And we should recognize the barriers to clarity as well, which would include words with vague and multiple meanings that the reader might misunderstand or misconstrue. And we have to weigh, as I've just argued, not only each word's denotation, but also its connotations. The writer Richard Rhodes, who does both fiction and nonfiction, and who won the Pulitzer Prize for his account of the making of the first atomic bomb, says that he always looks up his word origins. He wants to know where particular words come from and how they evolved. And he thinks this is necessary to get his diction balanced and appropriate. And it's true that English is especially complex. It's derived from a long and tumultuous mix over the last 2,000 years of Celtic languages, of Germanic languages, of Latin, of Norse, and of French. And these multiple layerings of conquering languages are why English has so many more synonyms than other languages have. In England's Middle Ages, for example, there were 3 official languages simultaneously in motion. There was English for the common people, Middle English for the common people, French for the aristocracy, and Latin for the church and the courts. And that's why the American legal system still invokes what they call doublets and triplets. And you've heard them on the police procedurals on TV, right? Where they say cease and desist, and aid and abet. Well, why do they use synonyms? Why do they repeat themselves? And it seems sort of gratuitous. And yet there is a specific reason. And the reason is that they are invoking the legal languages of English's medieval period. So they'll either be English and French in origin, or French and Latin in origin, or English and Latin in origin. And it's the very same reason why Thomas Jefferson chose to invoke the philosopher John Locke when he wrote the Declaration of Independence and wrote those famous words about life, liberty, and the pursuit of happiness. Because Jefferson and Locke both were consciously invoking those 3 official languages of the Middle Ages. Life is Old English, or is Middle English. All those monosyllabic words tend to be English words or Anglo-Saxon words. Liberty is the Latin word, and both pursuit and happiness are French words. So if we talk about precision and clarity, then the third requirement of effective writing is concision or conciseness or brevity, which means that we have to write what we mean to write in the way most likely to be understood by our intended audience in as brief a form as possible while still maintaining our complete meaning. And so it doesn't mean that you be brief for the sake of being brief. And sometimes you have to be. Sometimes your publisher only gives you 500 words space, but brevity really means refining your thoughts. It means cutting out the fluff and the redundancy and the mental throat clearing and the psychological warm-ups so that you can compact and polish until you get the right words to make your precise, clear point. And of course, the biggest barrier to concision is lack of preparation. It takes time and it takes multiple drafts to cut out all those fluffy phrases that don't really add anything to the discourse, but just slow down the reader. And for my students, that's about half. If you write 10 pages and you get it down to 5, you're on your way. And that's shocking for many of them. So let's talk about argument. You know, an editorial is an argument, right? It's meant to be persuasive, and I would argue myself that every scrap of communication, everything that we say and do in our daily lives all the time, let alone when we're sitting down to formally write an editorial, everything contains an element of argument. In academic speak, they say that all language is motivated. We want people to believe us. We want people to agree with us, to accept us, to accept our values and our goals and our judgments and our purposes. We want our patients to floss, right? We want them to come back in 6 months and get checked out again. We want our readers to keep reading. And because everything is an argument, now I want to describe a framework, a formal framework for setting up an argument. And first I tell my students that there are 3 distinct kinds of formal arguments, and I think they can serve us well as we decide how we're going to write our editorial. And those 3 kinds of argument are called fact, value, and policy-based arguments. So a fact-based proposition concentrates on showing that something is or isn't, that something is either true or false. And here's an example. If I say driving while texting causes accidents, well, maybe it's true or it's not. And now it's up to me to prove it, or to at least make it believable by finding and organizing and presenting some facts to support it. Now, in contrast, a value-based argument is really focused on opinion rather than absolute fact. It's about tastes and preferences. And so if I were to change my rant against texting while driving into a value-based argument, I would typically use a code word such as better or best or worse or worst. And here's an example. The best way to prevent auto accidents caused by texting is to ban texting while driving. All right, then a policy-based proposition zeroes in on the effect that a legal or a social rule would have. It's about changing the status quo. And the operative code word here is should. So my texting while driving argument, if I were to change it to a policy-based proposition, would be something like texting while driving should be illegal. So while each kind of argument has different formats and features that we need to recognize, all arguments share common goals that are well suited, and they have the same overall structure, I should say, also, that are well suited to dental editorials. The ideals, the goals of good presentation, of persuasive speech and persuasive writing, go back to Aristotle, who articulated what he called his 3 appeals of persuasion. And you may have even heard these in high school or college. This certainly has been around for more than a few thousand years. And they're still relevant, as it turns out. And in Greek, those appeals are logos, pathos, and ethos. Now, logos comes from our word logic, or from which our word logic descends, calls for arguing based on reason, on facts, on getting those right words in the right order, and on good organization. It's about getting your audience to think. Pathos, on the other hand, from which is derived our word pity, has to do with an emotional response, about getting our audience to not only think, but to also feel. And ethos, which is the basis of our word ethics today, is about establishing believability and credibility. In other words, getting the audience to trust us. And so while these actual models of argumentation go all the way back to Aristotle, my favorite way for explaining the structure of argument is attributed to a British philosopher named Stephen Tolman, who in 1958 wrote a book called The Uses of Argument. And Tolman proposes 7 steps, for achieving a tight, balanced argument. And I think it works really well. And so my adaptation of his 7 steps goes something like this. You identify your main idea. That's your thesis. And coming up with your argument is sometimes one of the very hardest things to do. And we can spend an hour or two just talking about how to brainstorm. And of course, reading helps me. Reading helps me brainstorm in it. I can read, I do read fiction, I read memoirs and history and a variety of other kinds of nonfiction. I scan lots of news stories and I love to read long form essays. And over time, I develop an ongoing list of about 30 or so editorials that I dip into and replenish as the months go by. And I can say confidently, really that with practice, the brainstorming part does get easier. But grasping the kernel of an idea can be hard because ideas are slippery. And as you write, as I argued a few minutes ago, your idea often changes, but you've got to start somewhere. So your idea, also called a claim, or also called a thesis, also called your main argument, it's something you can describe in a sentence or two, and you've got to start with this so that you can start thinking about how you might show it to be true. So you start off with a thesis, with an idea, and then you start thinking of reasons why it's good, why it's right, why it's true, why you should defend it. Once you have thought of some reasons, this is your whys, then you start coming up with examples, because you want to offer facts and statistics and stories and expert testimony that will help support your claim. So thesis, reasons, examples. Then you want to think about your assumptions. You want to know and you want to show why your claim is relevant. Your set of assumptions provides a link between your ideas, your thesis, and your evidence, all your examples. Here's an example. If you want to argue that dental schools should teach more business classes, which is a common argument, we still hear that a lot. Well, you have to identify your assumptions. And one of the assumptions is that dentists will go into private practice or managerial positions. And you want to make sure that your audience at least thinks that's true, or that the audience you're writing for sees that as a valid assumption. Because if most dentists are really going into employee positions, or maybe they're going into research positions where they'll never be managers, maybe that assumption is not quite as strong as you would like it to be. So you want to identify your assumptions, and that helps you clarify and strengthen the precision of your argument. So thesis, reasons, examples, assumptions. The next thing you want to do seems to some people counterintuitive. You want to recognize the limitations of your argument. And this can entail acknowledging counter arguments, or pointing out situations where your idea may not be true or as strong as you wish it were, and recognizing that your argument is not universal, that there might be people who argue against it, there are people who might not believe it, there are people who might say that's wrong. It's not a sign of weakness, but instead it builds that ethos, it builds your credibility. Because now you do the next thing. You identify your qualifiers, you identify the naysayers, the people who would argue against you, and you rebut them. You reinforce your argument, and you address the opposing views, and you say how and why your idea is stronger than competing ones. So the last thing you do then in these classic Tolman steps of putting together your editorial is penning a conclusion. You want to restate what you want the audience to believe. And then this is critical. I think you issue a call to action. You tell the audience what you want them to do as a consequence of having learned what they've learned from your editorial. This framework really works well for me in my own editorials, both in constructing the argument and arranging its parts, and also in helping me understand what kind of research I need to do to support it. Now, I briefly mentioned a few moments ago the value that I get for incorporating other kinds of writing, the elements of exposition and narration, for example, into my own editorials. One very useful technique, which I want to circle back to now, is that of description. I want to grab concrete words that help the reader visually and viscerally experience through sight, sound, touch, smell, taste, what I'm writing about. And in many cases, these concrete sensory details create a sense of intimacy, of the reader being with me in the situation and in the moment. And that intimacy is both intellectually and emotionally compelling. So when I write, I want to pay attention to both facts and truth. Facts are what happened, the events and the data, the situation at hand, but truth examines those circumstances and the context around those circumstances, and it becomes my interpretation of those facts. So facts are dispassionate while truth is personal. Editorials are personal. And I want to use not only facts, but also truth, if you will, to do my best to burn my editorial into both the hearts and the minds of my readers. So here's an example that I have used several times. Here's a description of a periodontal procedure that I went through about 15 years ago. A friend of mine who's a periodontist did a free gingival graft, and I described it first this way. This is fact based. I don't think any of this is untrue. That the periodontist dissected a split thickness segment of bound gingival tissue from the left side of my palate, just medial to the first and second molars and anterior to the tuberosity. Okay, that's a description. But if I make the event more personal about how I felt about it, what it seemed like to me, it becomes a little bit, and this is what I wrote. Damon drew a line, Damon being the periodontist friend, Damon drew a line down the roof of my mouth and I received a distant pressure. His assistant, Linda, dipped a steel suction tip past the purple gloves to meet my pooling wetness with a slurp. There was a push and a pinch, and a vermilion smudge flashing past my peripheral vision. I tasted rust. Filet of Eric, Damon said. So that's truth. And I always want to tell the truth. Well, there you go. In a half-hour nutshell, that's my take on writing an impactful editorial. It's in a process that helps me both understand the world and myself. It's a process that engages ideally those principles I've talked about: precision, clarity, conciseness, in as well-structured a framework as I can manage, supported by as strong a facts and as powerful a truth as I can come up with, using the best words that I can muster in the best order I can arrange. And so thank you very much. I really appreciate your sticking with me this morning. And I hope you get the same energy and enjoyment out of writing editorials as I do. And I wish you all the best, all of you, as you go out and tell your audience what's on your mind. Thanks again.
Thank you so